Hey, everybody. Welcome back to Dr. CC Says. Y'all, it has been an amazing day. Let me tell you, I have done pretty much two talks and was involved in a mentoring program, the start of a mentoring program today. So, talked about cultural humility this morning, talked about self care for mental health providers this afternoon did what I did with the mentoring program a little bit later. And now we are here on Dr. CC Says. So, y'all, I had all my favorite things in the same day. So, I am elated. Okay. And I'm even more elated because we got Kyanni, the Kneader, in the building. Hey,
Hey.
Kyanni. Yes. So, y'all, I'm going to read her bio. But Kyanni is my friend. She's also my massage therapist. So, provider who became a friend, who is still my provider, and who I just saw last week because,
Yeah.
yeah, I be needing all the things, y'all. All the things. I told y'all about wellness teams. If you don't have a wellness team, get you one, okay? Get you a team of people who help keep you going and keep you doing what it is you're supposed to be doing. And so Kyanni is one of the main people on that list for me. Yes. I see my sister is in the building. Hey, sis. So you all know how we do. If you are here, drop hello, hey, what it do, what's up, however you want to say it, drop it in the chat so we know that you are here with us. We love engagement, we love discussion. So drop any questions or comments. If you are watching the replay, drop hashtag replay in the chat so I know that you have been here. Okay. So, y'all know we are talking about leveling up. Right. And so I wanted to make sure because it's Women's History Month, right? We're doing all things women. I wanted to make sure that we discussed physical health because y'all know I'm always talking about mental health, but physical health and mental health go hand in hand, right? There is a mind body connection. And Kiana is going to tell us a little bit more about that tonight. But Kiani, let me give you a little bit of background and then I'm going to let her say hey to the people. Teresa, I see you in the comments. Hey, Dr. Joe, Bri. All right, so Kiani touches and heals the lives of others with her heart and hands. And y'all, I can attest to that personally. Okay. Her ministry is massage and body work. She uses her expertise to educate individuals about the vital importance of therapeutic touch. Kiana is the owner and operator of the Kneading Well, a massage and body work space. Yes, which is where she is tonight. She just got finished healing some folks, okay? She has dedicated over 20 years to optimizing the health and wellness of others on a professional level. From a registered nurse, case management director, and licensed massage therapist to changing mindsets about the power of touch and integrative wellness. Kiani inspires people to be better stewards of their health. Y'all, that's a whole word just right there. Better stewards. We talk about being better stewards of our time, better stewards of our money. We need to be better stewards of our health. Okay. And she helps people connect with their bodies to promote healing and relaxation, movement and mobility, and restoration and recovery. All the things. Okay. All the things. Yes, like I told y'all in the post, Kiani is all the things. All right. I'm gonna let her say hey to you all while I share the live. If you all know of anyone who needs to hear this, who needs to talk about physical health and how we level up in regards to physical health, please share the live with them. All right. Kiana, say hey to the people.
Hey people, how you doing? How you doing? Thank you for letting me in this space
Of
tonight.
course. Of course.
I appreciate it. Yes, I just got finished working on clients today. I can't keep count on how many clients it was, but I don't have to keep count because I love what I'm doing. So I could just keep doing it and doing it and doing it. And
Yeah.
as you can see, I'm laying hands on my lighting right now. It's going everywhere. But yes. Nice to be here. Nice of you to have me, Dr. CC. I
Of
appreciate it.
course. Of
And
course.
hey, everybody in the comments. Hey, Kev, how you doing? I see you.
Oh, hubby's on. Hey, hubby. Yes.
He
So
better not
yeah,
miss this. He better not miss this.
right, exactly. Look, he know. Okay, there we go. Y'all, I got it shared. All right. So we are going to jump in. So y'all know we have been talking about leveling up all year, right? Like that's the phrase, that's the word, that's the assignment that God gave me for 2023. And what that means for me is fully leaning into all the things that God has in store, right? If it's an assignment, I'm saying yes, right? This is my yes year. If it's scary, I'm going to do it scared. Okay. So it's all gas, no brakes, all 2023. We are walking in excellence. Okay. We are getting it done, doing what the Lord says. And because that's my assignment, guess what I got to do? I have to make sure that physically, mentally, emotionally, and spiritually, I'm in the place I'm supposed to be in. Okay, going back to that idea of having a wellness team. That's why we have to have people around us who care about us, who have our best interest at heart, and who have the expertise to help us in whatever area it is. Okay. So Kyanni is here tonight as a massage therapist, as a registered nurse, as all the things, as a speaker as well. She's also a speaker, all the things. And what I really wanted Kyanni to do for us tonight is talk about physical health, specifically for women. So, men that's on the call, you all still listen up because it can still apply to you. But we're talking specifically for women. And when I thought about Kyanni, I thought about this powerful story that she has and her relationship with blood pressure. And so I wanted Kyanni to share a little bit of that with us.
Yes, yes, yes. Unlike many of us, our our first introduction to, the blood pressure kind of getting a little wonky is later on in life.
Mm-hmm.
However, for me, I had my first blood pressure scare at 18 when I was pregnant with twins. I am a labor and delivery nurse or former labor and delivery nurse. So at 18, I really didn't understand that, what that meant. I just knew that the babies had to come out prematurely.
Mm-hmm.
My blood pressure was like 190s over, 110s. And I had a great doctor. Um, didn't really know what that meant after pregnancy until a year later. I was 19. I was in my freshman year of college, and I had this really, 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 really nagging headache. And I was really dysfunctional. So I worked in a lab, and they were really concerned. And so I made a doctor's appointment and went to the doctor's appointment, and my blood pressure was 170s over 110s. And this is a year later, so who
Wow.
knows what it had been between
Right.
that
Between
time
having the
span of when I
babies and
delivered and then
yeah.
when these headaches. So
Mm.
immediately they gave me clonidine sublingual to get my blood pressure down. And so that was my first introduction. They diagnosed me what was called essential hypertension. Okay. I don't think there's nothing necessary
Right.
about high blood pressure.
Yeah, that's an
But
interesting name.
what that really amounts to is
Mm.
that,
Oh, Kiana, I think we might be frozen.
how because about
Oh, Kiana, can you hear me?
I can hear you now.
Okay, yeah, we were frozen.
Okay. It took me about 4 years to get it under control. I was put on 4 blood pressure medications. I was put on a beta blocker. If anyone is aware of blood pressure medications, I was on in all the different classes. I was on a
Mm,
beta blocker, calcium channel blocker, a ACE inhibitor, and a diuretic. So
mm,
I was taking multiple high blood pressure pills um, every day.
wow.
And I wanted to go into medicine. So my goal in college was to go to medical school. So I started doing my research. And during high school, when I matriculated from high school into college before I got pregnant, um, I had a chance to do an internship at University of Maryland. and we met a lot of the it was for minority students, and we met
Mhm,
some of the esteemed professors. Um, and I got to sit in on um, like a physician's roundtable with a
mhm,
very esteemed, well-known national cardiologist. His name was Dr. Levi Watkins. And
okay.
his big thing was, doing research about high blood pressure in the African American community, and this is where I heard the word social determinants of health.
Mm,
So I really got involved and interested about, since I was aspiring to go to medical school, what could I do in my community to better health. Then I get pregnant.
life happens, right?
Then right? Then a year later that I have high blood pressure and I said, "Shoot, I am the community now." You know, what
Mm,
what can I do to better my situation? So I started doing a lot of research, and this is like really when I really got involved in my health at a very young age. I was overweight. Um, I grew up on canned food, hot dogs and beans, spam,
mhm.
lunch meat, Twinkies,
All
all
the
the
processed stuff.
all the processed things. So it wasn't really until then that I made a determination um, to change my health. I mean, and I had two kids. I was young. I wanted to make sure I was around to see them grow up because high blood
Mhm,
pressure is what they call the silent killer.
yeah,
It really wasn't until then and those things clicked that I changed things around um, in my life. Um,
mm,
it's about I started losing weight. Then I got pregnant with my third child. And I was like, dang it. After I had him in 2004, I was 245 pounds.
wow.
And I had already had high blood pressure. When I was pregnant with him, my glucola test was 139. So for when you're being tested for gestational diabetes and pregnant, the cutoff is 140. If it's 140 or above, then now you have to take the 3-hour test.
Okay, and
I
yours
was
was 1,
139.
so right there.
I was right there. So my provider did not send me for the 3-hour test. Okay,
Mm,
fine. Had a scheduled C section. He was 9 pounds, 7.2 ounces.
mm-mm,
So you could not convince me that I was gestational diabetic.
mhm,
6 months after having him, I get diagnosed with prediabetes.
mm,
So that right there was the straw that broke the camel's back for me. And I really had to take a hold of my health. You got to change to lose all that weight. You got to change up here.
yeah,
Um, I had to change my circumstances, my environment, definitely my food choices, and I had to start moving.
yeah, wow.
So I lost the most I've lost was 90 pounds.
Mm, which is definitely a feat.
It- and
Listen.
I lost 90 pounds. I've gained some back because now I'm focusing on building muscle and maintaining strength. So I lost 90 pounds, officially 90 pounds in 2017.
Mhm.
And that's been what, 5 years, 6 years, and I've been able to keep it off.
Yeah, 6 years. Yeah.
I've been able
Mm,
keep I mean, it's definitely a
right.
lifestyle change.
Yeah.
Total lifestyle change.
Yeah. So people, I hope, you all are hearing these numbers, and hopefully most people that are watching know what some of these numbers mean, or you're able to pick up the context of the story. But Kiani was near like being in trouble, right? In dangerous
Mhm.
waters.
Hypertensive crises, as they call it.
Yes, like multiple times, right? And to think of an 18-year-old with blood pressure that high, that's like almost unheard of. But one thing I heard you say, you had to take charge of your health and you actually had to advocate for yourself early on.
Yep.
And I
Yeah.
think that's the part that's missing a lot of times, for women in general, but specifically for women of color. We don't always know how to advocate for ourselves when it comes to medical settings, right? We
Yes.
don't know what questions to ask. And a lot of times, if we do ask or if we do express how we feel, we get the, oh, you're being a little too much, or maybe you're acting a little bit like what we're saying is not true. And I try to make it a point when I'm in the therapy room to make sure that I don't make people feel like I'm not hearing them, I'm not paying attention, or I think that they are being too much. Right? Because I
Mhm.
always tell them, you can't tell, nobody else can tell you how you feel.
Mhm. That
Right.
is the biggest, um being African American woman and not being
Mhm.
heard as
Mm.
far as our health is one of the biggest, especially when we're talking about maternal morbidity, when we're talking about in pregnancy, it is the
Mhm.
one leading factors to us dying,
Yeah.
is that we are not heard. Um, we are not taken seriously. So that being a registered nurse, especially in labor and delivery, that was one of the things that I made my mission with my patients, especially if they were women of color, to advocate
Mhm.
for them at the bedside, to make sure that they are heard, because we know our bodies. Our
Right.
providers, our physicians, our nurses, they're looking at numbers, they're looking at generalizations.
Mhm.
Not everyone shows up the same.
The same
Not
way.
every
Yeah.
even when we're talking about blood pressure. Right now, my blood pressure lives about 117 over 70s.
Mm.
If my blood pressure is 126 over 80s, that's too high for me.
Mhm.
So I know what my blood pressure is
Mm.
supposed to be doing at any given time. I still take it quite often, but
Yeah.
there may be someone out there who lives,
A little bit
a
higher.
little bit
Yeah.
higher or even a
Mhm.
little bit
Or
lower.
even lower. Yeah.
Right.
Yeah.
And these are things that you need to be able to voice and to be
Mhm.
able to speak with your provider. You are in control of your health.
Yeah.
We have to learn to be our own physicians. And I bring that up to say, so there is a quote that I actually love by Queen Afua, and it goes, when all of the women begin to be their own physicians and heal themselves, whether it be at heart level, a mental level, or physical level. When she begins to do all of her healing work, then she will be able to resurrect her family and be the medicine woman within her family. We as
Mhm.
women introduce our families to health.
Yeah.
We are introduced to regular health a lot of the times through prenatal care. Sometimes that's the only time we seek regular
Mm.
care.
Mhm.
But we are the ones, a lot of women, once they have kids, they put their health aside and they're focused on their children and their
Yep.
children's health.
Mhm.
But we're going to be no good to our kids, to our children, to our families if we don't do the healing work
Yeah.
within us.
Right.
So that,
And
as you
yeah.
said, that's emotional, that's physical,
Right.
you know,
Spiritual, all of
spiritual,
that.
that's
Yeah.
all of that.
Yeah. And if we understand that we're actually doing them a disservice when we don't model these types of behaviors, right? So
Right.
if they never see us go to the doctor, if they never hear of us talking about family history and checking our blood pressure and making sure our blood sugar is where it's supposed to be, and knowing like, oh, the doctor said I was probably fine, but I know my body and something doesn't feel right.
Mhm.
Right? If they never see any of that,
Right.
then they have to relearn this or learn it for the first time
Right.
in adulthood.
Right.
So when we don't take care of ourselves, we're actually doing a disservice to
Mhm.
the people that are watching us.
Mhm. And I take care of my client. I don't just take care of my clients with my hands on the table.
Mhm.
We have these
Yep,
conversations, and
absolutely.
my clients become my family. I had a client come in today. When he came last time, and because I know sometimes I know my body, my clients' bodies,
Mhm.
better than they do.
Listen, y'all, I can attest to it and I love it. Okay. My massage therapist, my chiropractor, and my acupuncturist are all the same way. They like, what's going on? Saw Dr.
Yep.
Levi. I saw you last Wednesday, saw Dr. Levi this Monday. And she said, when you spoke to me, your neck didn't fully move. I said, oh, it did? She was like, it didn't fully move. She was like, come on, I already know what treatment you need.
You
And
know,
look,
it is wonderful to have a wellness team that
listen,
has your back. My
yeah.
client, he also sees Dr. Levi laid on my table, and I said, "Something ain't right." And he was like, "Yeah, Dr. Levi says such and such." I said, "I am concerned."
Mm.
I worked on him and I
Mhm.
said, "You need to sit down this weekend
Mm.
because he has to
Mhm.
do everything." I was so concerned, he left. His wife is a client. Got on the phone. I said, wife, I'm just letting you know what happened. And we
Mhm.
have a relationship,
Yeah,
normally
that you can do that, right.
but we have a
Mhm.
relationship and I'm concerned. They're like family. I said, you need to make sure he does nothing this weekend.
Mm.
She asked him the next day, did you see Kyanni? Yeah, I saw her. Did she say anything? Oh, she called you, didn't she? Oh my God, she called
Mhm.
you. So between me, her, Dr. Levi, he sat down that weekend. So he comes
Good.
on my table today, and I almost forgot what
Mm.
happened a month ago because it had
Mm.
resolved itself. He got
See?
off the table. He said, "Do am I cleared? Do you have to make a phone call? And do I get?" I said, "You are good. You are good."
Listen, and tell look, we are our brother's keepers, right?
Yep,
Like, we just trying to make sure you stay here, bro. That's
yep,
it. That's it.
yep,
We
yep.
got some other folks in the comments. Hey, JJ Cub Helper, my brother is on, and Nikki is on. Hey, Nikki.
Hey, Nikki.
Yes, yeah.
Yeah.
Nikki says she really does, and you do, right? And because you do this type of work, and because we can have these types of conversations, I can then take that information, apply it to me,
Mhm,
right? Apply it to Kevin. And so when
mhm.
you tell Kevin something, when you see him, I can then, confirm that and reinforce that, right? And
Kevin, how
then
that shoulder doing? How that shoulder doing? We fixed?
listen, he was so excited. He was like, my range of motion. Look at this. I was like,
I don't
Kiana
know
put
where
in
that
some
came
work.
from. I don't know why I didn't get that before, but
Well, he got it now.
he
There we
got it
go.
now.
He
He
got
got
it
it now.
now.
That's
But
right.
then we can also share that with other people. And that goes back to what you said. And that really hit me that like we are the ones that introduce women are the ones who usually introduce health to
Mhm.
the family.
Yep,
Right.
yep,
We're the ones checking on everybody. We're the ones researching and getting the information. And not saying
yep.
that men can't, right?
Right.
And not saying that they don't, but a lot of times they do look to us to do that.
Yep. Mhm.
And so we have to make sure that we're doing it for us first.
Right. Exactly. Exactly. Do not put baby in a corner. Do not put
Yeah,
yourself in the corner. Please do
absolutely.
not do this. And then that's too how we get the negative perspective of health for ourselves because we watch our
Mm,
mothers, we watch our grandmothers, not take care of themselves. So we think it's okay to do
mm,
that. But at some
yeah,
point in time, nah.
yeah,
Mm-mm.
yeah.
It's you're doing yourself a disservice and you're doing your family, a disservice.
Absolutely, absolutely. And I think, if we wait until there's a problem to go to the doctor, right? We always associate the doctor with
Mhm.
problems. Well,
Yep,
that's because we didn't go until there was an
right.
issue,
As
right?
they say, an ounce of prevention is worth a pound of cure.
Yes, and we see this in therapy. If
Yep,
you wait until the child or the adult, whoever is in crisis, then it's like, oh, this is such hard work. Well, it's hard work now because we're in crisis.
right,
But if you had come in when it was just, oh, they're not sleeping well at night, oh, they climbed in my bed a couple of times this week saying that they were a little afraid. If we had come to therapy
right,
then, it would have been a totally different
right.
process.
Right. I have several clients that come to me and say, I some of them bring their whole medication list. So it ends up being a case management session. But
Mhm.
they'll say, the last time I went to the doctor, my blood pressure was up. and they put me on medication. Okay, we talk about the medication. Well, what was your blood pressure? It was 180 over 90. And you know I don't like taking medicine,
Ooh.
but sir, but ma'am, you need to take the medicine. Medication is technically not meant for you to be on the rest of your life most times, but you need
Mhm.
to take it right now. And then now you need to work on the functional
Mm.
ways
Yeah.
to heal, as Queen Afua said, to heal. You need to heal
Yeah.
yourself other ways. Movement,
Mm.
food,
Mhm.
you know, touch. These are the other
Mm.
3 ways that I like to tell my clients, you can make your situation better. You can make
Yeah.
your health better. You can get off of those
Mm.
medications quicker, sooner,
Mhm.
if you tend to these other
Mm.
medicinal ways. You know,
Mm.
I love
Yeah.
talking about how food is medicine. I mean, that's
Yeah, 'cause
how
it is.
I've healed myself.
Yeah.
Movement is medicine. That's how
Wow.
I've healed myself. Touch.
Mm.
That's how I I practice, trust me. I practice wholeheartedly what I preach.
Yeah. Yeah. And look, and the people that know you and come to you know that.
Yes.
Absolutely. But Kiana, that was a whole word right there. I don't think people realize, and I don't know if this is intentional or not, but I don't think people are given the message that these medications aren't meant forever.
They're not.
Right? I can name tons of people, right? Run out of fingers naming people that had the mindset and the attitude. Well, now I'm on this blood pressure medicine, or now I'm on this, diabetes medication, or now I'm on whatever. And, well, I just gotta, this something I'm gonna have to take for the rest of my life.
Mhm. Mhm. Or
Right?
I'm good. I'm taking this
Yeah.
medication. My blood
Right.
pressure
I
is
don't have to
fine.
do anything
And
else.
I'm good. I'm healed. You're not. So let me
Mm-mm.
tell you a little bit about medication. So medication, if we think about it, nothing about any medicine we take is found naturally in our body.
Mhm.
So
Mhm.
medication is automatically off the cuff toxic.
Mm.
So we have an organ called the liver that's detoxifies toxins that are put in our body. It breaks them down into metabolites, and then our kidneys gets it out of our bodies. So that means technically, anytime you take a medication, as soon as you take it, the liver deems it inactive through the first
Mm.
pass and goes out. So you're taking a medication for no reason if it's not going to work.
Mm.
Pharmaceutical companies have to intentionally make these medications extremely toxic. So when it goes through that first pass of the
Mm.
liver, it still has active activity to do
Right.
the job
Like
that
something actually sticks and
right,
stays
so
there.
actually works. And then
Mm.
so you have long-acting medication. So those things are like lethally toxic because it has to be in your body for such a long time and pass after pass after pass through the liver,
Wow.
it becomes ineffective. And then you have those you have to take like 2 times a day, 3 times a day. So
Mhm.
that will render it inactive after a certain amount of time. So
Mm.
medicines are toxic to the body and cause other side effects. I don't know what medication don't cause another side effect.
Right. Right. And if we look, they tell us about the side effects,
Exactly.
right?
And we
Yeah.
willingly take it.
Right. And let me put out a disclaimer. People, we are not telling you to not take
No,
your
we're
medication.
not saying don't take it.
Okay.
We're
Don't
not saying don't take it because if
listen.
I didn't never take my
Don't.
medication, I wouldn't be
Right.
where I am. But
Right.
there's adjunct therapies that can
Mhm.
help you
Yeah.
reduce the amount of medication that you're
Mhm.
on or even help you get off of the medication you're on. Medications
Right.
are necessary, but once
But they
again, they're not meant to take forever.
forever. Wow. Wow. And so, and this is why I love having friends and people in my corner and my circle that have all of this knowledge, because I've never said it that way. Right. But in therapy, people will come in and they're like, okay, we're coming in for anxiety, or we're coming in for ADHD. And we'll do some work. And then I'll say, hey, so these symptoms are so severe that we really can't do the work of therapy. And I'm like, we probably need to talk to a psychiatrist, a psychiatric nurse practitioner. Let's talk to somebody about some medications. And so they get the medication and they're like, oh, well, we don't need therapy, right? We're on medication. No. No, that's not how that works. You're taking the meds to lessen the symptoms enough for the person to do the behavioral work.
Right,
Right. But those are the other
right,
treatments that Kyanni's talking about, right?
right.
So this we see this with mental health as well as physical health.
Mhm,
Nobody, and I do tell them, you don't have to be on ADHD meds forever. That's not one of those meds you have to take
mhm,
forever, right? But you do have to do some work to
right,
make sure that you can be successful.
right. So my son was diagnosed with ADHD in the 2nd grade, early. They couldn't really give him an official
Yep.
diagnosis,
We
but we
have to
took
wait
what is it,
until
the
the
WISP, one of those
yeah, the
tests.
whisk and the
Uh-huh, right,
Woodcock
right, right.
Johnson. Yeah.
So, we put him he was on, methylphenidate,
Mhm.
and I did some research, and I started adding, um, fish oil with EPA and
Mhm.
DHA in it
Mhm.
to help with his, brain, and you need fat. You need fat,
Mhm.
omega 3,
The
6,
omega
9.
3s,
They're
yep.
very good for the brain,
Mhm.
and growth and development. So I started giving him that, always giving him his vitamins. And that adjunct really helped, to the point where, as your child grows on those ADHD medications, you have to up the dose.
Yeah.
But since it's weight based and stuff,
Right.
but we were able to slowly up the dose over time because we I was doing other things,
You had supplements.
other
Yeah.
natural things,
Yeah.
food. So just like hypertension, celery. If you have hypertension, there's something in celery that is good for those with hypertension. Beets. So beets have
Mhm.
nitric oxide in it. They dilate the blood vessels. So
Mhm.
beets, so there are a lot of other their food. Like I said, food is medicine. There's other foods that you should incorporate in your diet, especially if you have certain chronic conditions. Gut health. Gut, there is a brain gut connection there,
Connection. Yep.
that affects even people with anxiety and depression. So if you can learn to control what you eat, sometimes there are symptoms of depression and anxiety. We just have to do the work.
Yeah.
And a lot
Yeah.
of us don't want to do the work.
Yeah. And I think a lot of us we haven't been empowered either, right? Like,
Right.
people think that like with therapy, they come in and they see that things are working and they think they're supposed to be in therapy forever, right? So now therapy is like medication. Oh, we got to do it forever. No, like we're trying to empower you to take the skills, the tools,
Yes.
the techniques and be able to do those on your own.
Oh,
You don't have to come see me until you're 25 and then we switch you over to a different therapist. Mm-mm. You can learn what to do for yourself. And that's what Kyanni is talking about, y'all, for our physical health. There are so many things that we can do to help. There are also things that we can do to hinder. And I think, Kyanni, when you was talking about medication, and medicine and food and how with food, sometimes it helps. There are some other foods that hinder or hurt,
yes. Yes.
right? And
Yes.
and this became apparent to me when I because I will always research the medication that my family members are taking, right? And so my grandma, God rest her soul, she was taking a blood thinner. Well, she was also eating all the foods that would thicken your blood. And I was like, Granny, you can't do both, right? Like you taking the blood thinner, but then you eating
Right.
greens and all this other stuff, which by
Right.
themselves, nothing wrong with greens, right?
Right.
But they thicken your blood.
Blood. Right.
And so I'm
Right.
like, you're counteracting the medication.
Right, right, right. Yeah. I mean, even when you think about conditions such as, so I believe in functional medicine. So I do my own personal testing. I buy
Mhm,
kits, functional medicine kits. So um without some of this information, I'm not able to I can better control what I put in my body. So for me,
mhm,
for instance, I can't do crab, I can't do shrimp. And because I have uric acid pathways that are not optimal. And so certain
mhm,
foods that have purines in it make you more prone to gout. Now, I haven't had a gout, I have never been diagnosed with gout, haven't had any
mhm,
gout, but these tests let me know ahead of time so I can be
mm,
proactive and
mhm,
preventative. So
yeah,
I don't do turkey, I don't do crab, I don't do, but then there's other foods that are superfoods just for me because
mhm,
the tests are designed to give you these recommendations just for you and your gut.
Mhm,
So,
mhm,
strawberries, kiwi, pineapple, because pineapple helps with digestion. So,
mm,
like, now I can it opens the door up to food choices that
mhm,
either I've never tried before, never considered before, but I'm truly eating foods that are therapeutic and medicinal to
mm.
me,
I
and
love it.
things that I am trying to, ward off, so to speak.
Right, right. I love it. Now, because we're talking about proactive, and that was one of our questions. How do we, as women, do some proactive things for our health? Kyanni, tell us where people can get these functional tests, right? And maybe they won't be able to do them at home like you're doing because
Right,
you already have that knowledge. But what kind of physician or practitioner can
right.
people go to for these types of tests?
So definitely, so there are functional medicine doctors out here.
Okay.
There are some chiropractors that act as functional medicine providers.
Okay.
But yes, you can definitely search for functional medicine providers because they help you control things with supplements that
Mm.
are meant to be found in food. So you take a supplement
Okay, Kiana,
um,
say that part for me
instead.
again because it went out. You said functional.
Oh, it went out, it went out.
Yes.
So, functional medicine providers,
Mhm.
and a lot of them are very well versed with supplements,
Mhm.
and supplements are actually things that the body, is meant to digest, absorb,
Mhm.
and your cells are meant to have, for them to function.
Yeah.
There are certain chiropractors that act as functional medicine experts. Um, you know, me being who I am, I'm the one person. I don't say do this because I know what I know and I do what I do and I know
Right.
my body. I'm the one. I reduced the amount of my blood pressure medication on my own and tell my doctor. And when I
Ooh.
went there, she was like, "Oh, your blood pressure is doing fine. Let's get the prescription in." And I'm like, I need to tell you something." I reduced it, and she was like, "Oh, okay, let's change the prescription then."
So
Don't do that.
look,
But
what another disclaimer. Okay, y'all heard me say Kiana is a registered nurse. She can do that. Don't y'all be out there trying to
don't
put
do
y'all
that. Don't
medication
do that.
and
Don't
don't
do
do
that.
that.
Don't do that.
Okay.
But
Go to
like
the doctor.
Everly Well has functional medicine tests for gut
Mm,
health. The
mm.
company that I use is Viome, Viome, and they
I'm gonna
have
put that in the chat.
several types of functional medicine tests. They got the Cadillac and they got the Subaru, you know, and
Mhm.
based on what you're looking for, um, that would be the one, that you take.
Yeah.
Um, you can start off small. Yes, Viome.
Okay.
So that's what I kind of do on my own because, like I said, I want to treat myself with food.
Mhm.
I want to treat myself with movement.
Mm.
Movement is good for the mind,
Yes.
and it's good for the body. It's good for the lymphatic system. That's a whole nother conversation, that we don't really understand the power of our lymphatic system. And our
Mhm.
lymphatic system, unlike our cardiovascular system, doesn't have a pump. Our cardiovascular system, our heart is our pump. Our vessels have smooth muscles that pump the blood throughout the body. Our
Mhm.
lymphatic system works very in tandem with the cardiovascular system, but the lymphatic system has all that gunk. It's like the sewer system in the
Yep.
roadways. You know what I mean? And
And it
so the
needs to be
lymphatic
cleared
system
out. Mhm.
does not have a pump. So you have to move. That includes walking, that includes
Mhm.
exercise to really get those things moving out of your body.
Yeah.
Or come see me.
Yeah, exactly. So yeah, so look, a little quick story, and I see Coco in the chat. Hey sis, I see Tanika in the chat. Hey y'all. So when I was looking for a massage therapist, right? So Dr. Levi, of course, was like, hey, you got to go see Kyanni. So y'all, I do my research. And so I was looking her up, and I'm telling you this story because I want you to understand that God will give you everything you need. Okay. And so I was looking Kiani up, and what I specifically wanted, and I think I said this to Dr. Levi, I wanted a lymph massage, and I wanted somebody that knew what they were doing to do this lymph massage. And so what I have been looking up was, why am I having these headaches? Why am I feeling so cloudy? Like brain function wise, like why am I feeling a little bit slower on the uptake than normal? Put in my symptoms. Again, disclaimer, you can't look up everything on social media or on Google. Okay. WebMD will tell you that you're going to die tomorrow. So you got to take everything with a grain of salt. But I have been doing mental health long enough, and mental health and physical health go hand in hand. So I know how to kind of, pick and choose and look at things a certain way. So Google, and they said you probably need a lymph massage. Okay, that was God, right? God was telling me that that's what was needed. So I look up Kyanni, and first thing I see, right, lymph massage was one of her offerings. So I didn't. This wasn't even. I had to go in and ask about it, because other massage therapists, if you ask about it, they'll say yes, I do it, but it's not listed anywhere. Okay, and y'all, Kyanni is also certified in lymph massage. We didn't mention that at the beginning, but she's also certified in that as well. Lymph drainage, right?
Manual
Yeah.
lymphatic drainage. Yep.
Yes. And when I looked at her background, I said, "Oh, she a registered nurse." I said, "Oh, so I know she know what she doing."
I
Okay,
better.
got it. Right? Like, oh, she know for real. And y'all, when I first met her, fell in love with her, and that was one of the best massages I have ever had in my life. And y'all, that headache was gone, and that mental fogginess was gone. Right? So I that was confirmation that God dropped that in my spirit to even look for someone to do that. So, yes, look up things, go to professionals. I would wholeheartedly believe in people going to folks that are trained and licensed to do what they're doing. Also, though, talk to Jesus and let him let him direct you. Okay. He will send you where you need to be.
Yes,
Yeah.
yes.
Yeah. So that's my
Because
story about that.
he brought Dr. Cece into my life. So, and
Look,
enough said. Say less.
listen,
Say less.
listen, say less.
Say
Yes,
less.
it's been magic ever since.
It
Okay.
has. It truly has.
Yes.
It truly has.
Now, you've already told us a little bit of this, but I want to make it real clear for the people. Tell us how massage therapy helps with like blood pressure and maybe like diabetes and all these other things as well.
Woof, 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 woof. It's a whole list.
Didn't I mention?
Basically, one of the big things is touch. Uh, it it interacts with our endocrine system. That makes and produces hormones. So some of the major hormones that massage helps to increase in the body are serotonin,
Hmm.
are dopamine, are endorphins,
Yeah.
and a lot of these hormones, especially serotonin, um, reduces, oh, and it also reduces cortisol. So we know that is the
Mm,
major stress hormone. So that's how it reduces high blood pressure. That's how it reduces anxiety, stress, depression, including serotonin, which is the mood stabilizer
mhm.
hormone of the body. It increases the levels in our body. So then it decreases those bad feelings, that
Yeah.
we have. Dopamine is that reward and motivation. So it kind of
Yeah.
makes us chipper. And then we have oxytocin, which is the bonding hormone that makes us happy, that makes us
Yeah.
connected. So, massage really helps to bring out these hormones in a positive type of way in our body that helps to um, uh, uh, do all of these wonderful things.
Mhm.
Relaxes muscle,
Yeah.
calms the mind. I love putting people to sleep on my table because sometimes that is I call it therapeutic rest. They snore,
Yeah.
I don't hear it. I'm like, you're getting your therapeutic rest. And because sometimes we have a hard time shutting off our brains.
Yep.
So I
Absolutely.
really love shutting off people's brains. I love it when they snore because that means I can really do what I need to do.
Listen,
And they
have
wake
you
up a whole different person.
right. Look, wake up and don't even like, wait, we finished?
Yeah.
Okay. Like
Yep.
I forgot I was even here.
Yep.
Yes.
And the
Yes,
best part
all of
about what
that.
I do, when you go to spas and other massage therapists, they have this big old menu: hot stone,
Mhm,
deep tissue, Swedish. You get on my table, and I'm gonna give you what you need. So
mhm,
if we're gonna do hot stone, or if I feel like you need hot stone, you're gonna get hot stone. If
mhm,
I feel something, we're gonna do cupping. I'm not gonna charge you extra for something that you need that you don't even know you need. So I let these
mm.
hands be the diagnostic tools, be the x-ray, be the MRI,
Yeah.
because medicine before we had all these handy dandy tools, we had inspection, palpation, auscultation. We had all of these assessment techniques that go out the door when we
Mhm,
have everything we need right here to heal.
mm,
Jesus
look,
healed with what? Hands.
with his
People
hands.
touched
Come
the garment of
on,
his clothes
come
and were
on.
healed.
Look, you better go on and preach. Yeah, yeah. Look, and your other patient over here, Kevin, talking about I woke myself up one time.
Yeah,
Child,
I don't pay him no mind. I don't
none
pay him no mind.
whatsoever.
Turn
None
over, go back
whatsoever.
to sleep. Put your head back down. We ain't done yet.
Right. But y'all, I for real, Kiani is not in any way exaggerating. Do you hear me? Like she finds where the issues are. And and what I love is the education that comes with it. Right. So
Mhm.
she's like, huh, how did this get this way? My answer is always, I don't know.
No.
Right? Like, I don't know what I did something, I'm sure. I don't know what it was. And so she'll do what she needs to do. And then she'll say, and this is what you need to do after this.
Yeah.
Okay. And so everybody can't have Kyanni, all right? Because everybody, most of the people on here are not even in Maryland. So everybody won't be able to have Kyanni, but get someone who
Yes.
understands and knows that healing comes from more than just medication.
Mhm.
Right, who understands that like, "Oh, okay, you said you wanted a hot stone massage because you saw that somewhere and it looked real cool."
Or you need a
But
deep tissue. That's the big one. I want a deep tissue massage. Uh, let's
mm,
let's 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 ease into deep tissue because
right,
not
because
everybody needs deep tissue. It
right,
sounds good. It sounds like you're healing, but
mm-mm.
it's uncomfortable. It's
Right,
really
and I don't think people understand that, right? Like, you trying to relax, deep tissue, now that's work.
right, and you don't need it. Majority of the time, you don't need it.
Mhm,
You don't
mhm.
need
Yeah. Yeah, but again, wellness teams, right? Y'all get some folks who are going to walk this journey with you and who have your best interest at heart,
it.
who
Mhm.
are passionate about what they do. I hope y'all can see how passionate Kiana is about what she does,
Yes.
right? Get some folks who are going to walk with you on this journey. They might not always look like you. Now, I am always on a quest to find providers that look like me.
Yes.
Okay. But that's not the only criteria because you're going to meet people that look like you that still might be a little more Western minded than maybe you want to be.
Mhm.
And that is what I figured out. All of my providers, whether they are into Western medicine or not, they also understand the benefits of integrated well care, right? Yes, like they understand like wellness, they understand all of those things, and they understand that everything doesn't come in the form of a pill.
Right.
Right. And
Right.
they understand that they need to listen to you. "Hey,
Mhm.
Sarah Pam." Yeah, she said, "Kiana is amazing." Yes, she is. Yes. So, yes, so y'all, we wrapping up, but we not quite through because I want Kiana, and I put this in the post, so I had to make sure I did it. I want Kiana to tell us about her being the hug dealer. Okay. Y'all see she got on her shirt, it said free hugs. All right.
Oh my gosh. Oh my gosh. So it was kind of a roundabout way because as a massage therapist, I see a lot of couples in my practice.
You do.
And
Mhm.
I'd be like, y'all not touching at home. Like, or I have a couple whose partner doesn't come to see me and they're like, I try to get him to rub me like you do, and he only lasts 5 minutes, and it's just, and then I'm like, well, if he actually massaged you in between massages, then maybe he wouldn't come back to me so jacked up. So maybe I need to do something.
Look, so let
Like
me
maybe
help
I need
them help
to
me.
educate. Maybe I
Right.
need to educate couples how to actually physically touch therapeutically at home, not sex. But and then we know touch increases oxytocin, increases bonding, and And that can really save and help relationships and communication. Love
Yeah.
language, physical touch. Well, in doing my research, one of the things that I found out was that couples don't really hug much.
Mm.
Um, and so I was going through some things. I lost my parents, one right after another in less than a year, and I felt like I needed hugs. So I did this
Yeah.
hug challenge in February. For 28 days, I hugged one person, couple people, whatever, and it changed me, and it changed other people to the point where I had clients, as soon as they came in, they were like, "Where's my hug?" Because I
Right.
posted my journey on social media every day. Or clients who necessarily are not huggers welcomed the hug. And I'm
Mhm.
like, you need to do this more at home. And I was like, you know what? And I did a talk about it last
Mhm.
weekend,
Mhm.
and I took on the persona as the hug dealer. So, matter of fact, today I had a friend, an old friend. He's going through some things. He texted me. He said, "Can I buy a hug?" So I often send virtual hugs, just checking on people. I send hug emojis, hug memes,
Mhm.
out to folks. I post a lot on social media about hugs and couples hugging, and talk about hugs as a form of touch. Just like massage, it produces all of those
Yep.
hormones. It really causes connects you. It really helps people going through things, and you just never know what somebody is going through. I have clients leave me, and here I think I did an amazing job massaging
Mhm.
them, and then I hug them, and they say, "I needed that."
That.
I was
Mhm.
like, "Well, we could have sat here for a whole 60 minutes and hugged."
That's what you wanted, right, right. But
But
there
it's a way I connect
yeah,
the body with the heart,
yeah,
because a lot of times I'm so connected to my clients' bodies that I don't sometimes, well, I connect with their heart, me, but my heart and their heart doesn't
yeah,
connect. So
yeah,
it's kind of a way I connect the body and the heart in my sessions. And I really enjoy it. I have clients that text me like, "I'm coming. I need my hug." Or I'll have friends that text me now and say, when are we gonna see each other again? Because I gotta get my hug. So
yeah,
like people are listening, and I just want people to
yeah,
hug more. You may not come for massage, and that's fine. That may not be everybody's jam,
right.
but you need some form of touch, and hug is a universal language. Every nationality, every creed, you know, knows what a hug is. So
Yes.
it's a universal language. It's communication. We in the United States don't hug enough.
Mhm.
It's a sign of respect.
Yeah,
It's a greeting. It's a natural greeting in other countries. And I think sometimes we can help some of our issues, our
yeah,
crises, our
yeah.
family issues, our connection issues with a hug.
Absolutely, absolutely, and you even had someone walk up to you that knew you from social media, but
Yes, yes. So I was warming up my car one morning. This lady in the distance came and was like, "Hold up, hold up, hold up." And I'm like, "Who is this lady?" So I stood there, and as she approached, I still didn't recognize her. She was like,
Mhm.
"My name is Valerie. I'm your Facebook friend. Where's my hug?" And I was like, "No, finally I get to put a face with a name."
Yeah,
And it was just, it really, really made my day in that moment, that
yeah,
people are listening, and they're welcoming, and
right.
they're initiating it to me. You're like, this was my idea. And they're
But they're taking
showering me
yeah.
with hugs.
They're taking it and running with it, and what I love, right, like, that research has been there, but
Hmm.
that's why it's so important for us to do what it is that God has called us to do,
Yeah.
right? Because people needed to hear it from you.
Right.
There were some people who would have
Right.
never heard that from the research, right? And like I said, that
Right.
research has been out there that you
20
need to hug
seconds. 20
yeah,
seconds.
20 seconds. You need to hug for at least 20 seconds to
Yep.
get some physical, emotional,
Therapy. Yep.
and even some spiritual, right, like, benefits from it.
Hmm.
That research has been there, but Kyanni says it the way that it needs to be said for certain people to hear it.
Right. And
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 that
and
that
hugs
part,
take other forms. So I purchased a hug ring. If you can see, there are two arms.
I
And
love it.
inside it says, "I love you, mom." I will never
Mhm.
get to hug my mother again.
Yeah.
So I needed to find a way to metaphorically represent those hugs that
Yeah.
I won't get to have with her.
Yeah.
So I wear a hug ring. So, you know,
Mhm.
metaphorically, you can give people a hug, you know.
Yeah.
You can give them a smile. A smile is a hug,
Mhm.
you know,
Absolutely.
especially if some people don't like to touch. I mean, I don't just go around hugging people without getting their permission.
Right, we
But,
need
you know, you
consent.
can do other
Mhm.
little things. You know, I do a lot of, you know, when I'm doing these
Right.
lives, I do a lot of virtual hugs, self hug. Believe it or not, a self hug has the same benefits and releases the same hormones as hugging
Mhm.
someone else. So I have a hug buddy at home, and it's a stuffed animal. His name is George. So anytime I feel like I need to hug, I hug my hug buddy. You can
Yeah.
use a pillow. I just this doesn't kind of do it for me.
Don't quite do it for you, right.
So I need that tactile stimulation. So I use a
Yeah.
stuffed animal. When I need a hug, I hug them.
I love it. I love it. And y'all, I've followed the journey, and so I know about the 28 days of hug and how she has developed into the hug dealer. But I wanted to make sure that other people could hear it. And we have people in the chat. Nisi is on. Hey, Nisi Poo. She said a hug is so therapeutic for me.
It
Yes.
is.
And it really now there are people who don't like touch, absolutely. But for most people, like Kyanni said, is universal. It really communicates. It's like heart language, right? It's
Right.
going from one heart to the next.
Yeah.
Yeah.
And
Stephanie,
safe. You know, you feel
yeah,
so safe with someone when
yeah,
you can
absolutely.
engage in a therapeutic hug. You feel seen.
Yes.
You know what I mean? You feel,
Uh-oh.
you know, a
Kyanni, okay.
platonic relationship with them.
Yeah,
It
you went
just
out just a
speaks
little
to
bit.
your heart. You know, it speaks to your heart. That's what's important.
Yeah. Yeah, I love that. I love that. Yeah, Coach Stephanie is on. She said, that's so cool. And Miss Ellen, she says, I know the feeling. I'm a hugger. I feel there is something spiritual about it.
It
It's
is.
just who I am.
It is.
Absolutely.
It is. Because we
Absolutely.
are love. We are love. And
Yes.
hugging relays that message. We are all
Absolutely.
love. And that's a
Absolutely.
perfect way to tap into the love within you. They say
Yeah.
hugs are like a boomerang. You know what I mean? You give it and it's right back at you.
And it comes back to you. Absolutely. Absolutely. Yes. So, Kiana, I could talk to you all night,
I know,
right?
right?
You already know. You already know. But tell the people how they can follow you and where they can find you.
So you can find me on social media. I'm always hanging on them social media streets, doing TikToks, doing little funny things. Kevin was in a TikTok with me. I'm gonna have to get you in a TikTok with me, so I can see. I
Okay.
picked TikTok specifically for the person, so I gotta find one that's gonna fit you.
Yeah, let me know.
I'm at the Kneading Well. I'm on Instagram at the Kneading Well. Also at Kyanni underscore the underscore Kneader. That's my personal page. At the Kneading Well is my business page on Facebook, the Kneading Well page, and my personal page is Kyanni Nicole. So
Right.
it's depending on what you. I'm on LinkedIn as well as Kyanni Fleming. TikTok. You know, I'm all over these social media
Right.
streets, spreading
Right.
my love, spreading my love.
Yeah, and so y'all, I will tag her in a comment. I will also make sure I know this is going to Heart and Soul. So anybody watching on my professional page, you all are getting all these comments. Everybody else that's on my personal page, I will go back and put these
I
links
know. I hate
on
that.
there.
I hate that
I
about
know,
you
right?
all.
It only goes to one, but
I
that's
know.
okay.
Yes,
And
it is.
so, if you all want to get a hug and you want to see Kiani in person, I know one place she's going to be. She is going to be at the Free Before 40 2023 Women's Conference
Yes.
on Saturday, July 15th.
Yes.
Okay.
Calendar already blocked. Sorry,
Yes.
clients. I'm
Right.
taken.
Right. Hey. So, and look, and tell them to come on.
Yes,
Come
I
on, get a
will. I
coffee.
will.
Right.
I will.
Yeah. So, y'all, she will be in the place at the conference, which will be in Baltimore. So, if you all are in the area, definitely, come on by, stop by, and
Come
spend
get a
the day
hug.
with
Come
us.
get a hug.
Come
Come get
get
a
a
hug.
hug.
Come get a
Yeah.
hug.
And for my folks that are out of town, make your plans now so you can
Yes.
be there. Yeah.
Yes.
Yes. But Kiani, as
I'm gonna have a hug
always,
station. Can I have a 20-second hug station?
yes, you surely can. Come on. I love it. I love it. Look, we out here just addressing all the people's needs at the same
That's
time.
right.
We're gonna
That's
be
right.
free. We're gonna have
I
all the
bring my massage
emotional.
chair.
Right.
You know,
Look,
yes.
you gonna do massages? Imma have to okay, yeah, we gonna talk about that. Imma see if we can't get her to do some massages, during, during lunch or something. See if we can't get some massages going. Okay, okay. But Kiana, as always, I love talking to you. I love having you with me. Thank you so much for
Likewise.
agreeing to be here.
Yes, yes, yes.
Yes, yes. And so you all make sure that you follow, like her pages. She's always putting out some good information. Okay, so make sure you are following, and I will let you all know about next week as far as Dr. Cece says. Pretty sure we're gonna have it same time, same place, but I'll let you know. I'll let you know. But that is it for us tonight, y'all. I hope you all have enjoyed. Yes, and you all look, hug, right? Make sure you get your hugs in.
It's
Make
not too
sure
late.
you
Got
right.
some time.
And make sure you are proactive about your health. Make sure you're getting some movement in. You are using food as medicine, right? And make sure that we are modeling all of these good behaviors for the people that's coming on after us and the people
Yes,
that's watching us.
yes, yes,
Okay.
yes.
All right, y'all.
Our
That's it
health
for
is our
tonight.
wealth.
Yes, our health is our wealth. Absolutely. So, y'all, that is it. Y'all be blessed. Bye. Yeah.